One Health, in this case, the One Health initiative that we are launching and addressing now is focusing on the diseases that have been crossing from animals to man.
The year 2010 saw the birth of One Health Central and Eastern Africa, OHCEA, embraced by a few institutions in just 6 countries in East and Central Africa. Then, this university network progressively expanded to cover West Africa, bringing on board more and diverse institutions. OHCEA, however, has its roots in the Leadership Initiative for Public Health in East Africa, LIPHEA, which a few years later changed to Health Emergencies Management Program, HEMP. These changes were a natural response to emerging needs in the health management arena.
In our first meeting with all these deans, we said, who else impacts public health? We realized veterinary was key, nursing was key, and the environment. So we invited, and with the support from USAID, we brought in schools of veterinary. Each school of public health that was involved invited one other school of veterinary in their country. So we made schools of public health and schools of veterinary to meet, and when we met, the name had to change, and it changed to One Health. But just before it changed to One Health, as that project was ending of LIPHEA, we realized there were so many epidemics in the region. We formed ourselves into HEMP, but then we were schools of public health. Then when we brought in the schools of veterinary, we said we can't be HEMP. So we became OHCEA, One Health Central Eastern Africa.
The first 5 years of the network operation from 2010 to 2014 entailed development of proof of concept, which basically involved members of the network learning how to work together, how to partner together, and setting up management systems, setting up governance systems, and testing out these systems. So from 2015 to 2019, it was a dynamic phase where the network had learned a lot during the proof of concept phase in the first 5 years. So at this point, the network was engaging for higher impact. We were engaging partners more. We engaged the government to assess the workforce needs. We also engaged university institutions within the network to standardize most of our programs. And also we started discussions around institutionalization of our programs. But also that time, it entailed growth of the network in terms of geographic expansion. We expanded from Central and Eastern Africa, which was a focus and OHCEA, to West Africa. We went to Cameroon, and now we are also operating in Côte d'Ivoire. That is a recent addition to the network.
Personally, I thank the team that I started with.
I am a founding member of OHCEA, and we had a vision about OHCEA. Actually, it started in the year 2005 when we were having a project called LIPHEA, Leadership Initiative for Public Health in East Africa. And at that time, we were dealing with disaster management and response, working with the Office of the Prime Minister in Tanzania, and we trained a lot of in-service personnel in disaster management. That was LIPHEA.
We started this network principally because of looking at the future. At the time of initiating this network, we had predicted that the intensification of humans due to increased globalization and increased population explosion and search for needs of humans would result in increased contact, increased numbers of animals, increased numbers of plants, movement, and so on. Along with that intensification of contact is invisible intensification of organisms that are not seen, the microorganisms. So the more animals you have, the more food you have, the more contact you have, the bigger also the population of these organisms, and therefore the more contact. Universities by nature are transboundary. That's why we are called university. So as an entry point into building this web of effort across Africa to cordon off the spread of germs, a university is a strong area of entry. Because universities work together across borders, we are in a position to create curricula, we are in a position to do research and surveillance, and draw an early warning system that can feed into the government efforts. Government efforts tend to be more national in nature than regional. So the universities are bringing that strength and advantage to bring the knowledge to flow quickly from country to country, and therefore help the national efforts of Ministry of Health, Ministry of Agriculture, animal industries, food security, and so on, to coordinate and build together. And therefore, the Africa-wide network has now become very strong to drive that agenda.
To date, the network is working to transform the training environment and approaches in universities in a bid to develop a workforce without disciplinary barriers, enabling students to understand and appreciate the contribution of disciplines outside their own in predicting, detecting, and responding to the kind of complex health challenges we are witnessing today. This is the next generation workforce that we need in the face of increasing outbreaks of epidemics. To achieve this transformation, we are reviewing curricula to integrate One Health, designing new and exciting experimental learning multidisciplinary training programs, retooling teachers and trainers, educating communities on existence and transmission of zoonotic and infectious diseases, while engaging national and subnational governments to integrate One Health into national policy and strategic planning. One Health Central and Eastern Africa, OHCEA, has evolved into Africa One Health University Network, AFROHUN, an international network spreading further and deeper into the continent.
OHCEA, as I said, encompasses One Health for Central, Eastern, and Central Africa. But we got this urge of people joining OHCEA. And initially, we were resistant, we loved the name. Even those who are from West Africa can join. And when they join, they'll certainly benefit from these programs. So we admitted them initially as members. We admitted more universities in the region, more universities in West Africa, and through that we said, let us now be broad, because we are now more relevant to Africa. We can challenge all the pandemics that come, and we said, let us find a name.
Some of the triggers of the new direction is the high demand for the network services. We are at a point where the world needs efficient workforce, a workforce with modern knowledge, but with the ability and the skills to network across sectors. Find they have their technical skills, but they should be able to apply those technical skills, of course, to meet their international health regulations at national level. But also they should be able to work across sectors. They should be able to bring together a team, an efficient team that is able to, that has the ability to detect, respond, and also prevent emergencies at the interface of the human-animal ecosystem.
As AFROHUN repositions herself, sustainability and engagement in high-impact programming are going to be key features of the network.
So we have developed the academy with programs that are going to teach people, but they will not teach for free. They will be online, and they will be for different communities. Students will access these trainings at a different cost. Faculty will do the same. And then the in-service people. Because those who are in service, we need to do refresher courses, but we don't need to bring them to class. We can teach them while online. And now, that will be one way of raising resources. But most important, it will make us more relevant to our ministries, to our communities. Because if you have an outbreak, say in Chisoro, an outbreak in Addis Ababa, we have scattered, trained, well-trained and facilitated personnel to tackle the pandemics.
The AFROHUN promise, as we look towards the future, is really exciting. So we're at a point where we've learned a lot in the past 11 years. We've also achieved a lot in the past 11 years. So we are consolidating what we've learned and consolidating those achievements into very few but high impact programs. The most exciting bit about the future and what we are promising is that these programs are going to appeal to national interests, but also to international interests, continental. They'll be accessible Africa-wide and also globally.